Warm greetings to all of you from the Hospital and Rehabilitation Center for Disabled Children here in Nepal. Our hospital is a hospital-based service provider along with a extensive community rehabilitation program linked service in which we treat underprivileged children under the age of 18 with musculoskeletal disabilities. The children come from far corners of Nepal, and we also receive a good number of children from the bordering towns of India. I have had the privilege of establishing this service since 1985, and the challenges have been enormous, but the rewards also have been unparalleled. Let's just go through the story of a child that has been treated, which will give you a very comprehensive idea about what we do and in the manner in which we pursue the challenges that confront us. Lakshmi is a little village girl from the Dhading district of mid-Nepal. She sustained injuries by falling into an open fire burn in her own home. This is often the way cooking is carried out in a rural Nepalese home. Children are exposed to risks of getting injured. She burnt her leg, she lost part of her leg through an auto amputation, was never able to seek any medical treatment, and her life is just a miserable, futile life of a child who has nothing to look forward to. She sometimes went to school when her mother had the time to carry her. Sometimes she dragged herself behind other children who were able. Often they mimicked and laughed at her. And when children played in school, she just spent her time in a little corner, lamenting, and you can imagine the plight of a child with a disability like this when they cannot interact with other children. And she was always jostled around, pushed and bullied by others. But everything changed when Lakshmi was identified by our field workers and referred to the hospital for rehabilitation. Through a very simple revision procedure, our team of doctors and prosthetic technicians were able to make a plan for her. A prosthesis was measured after her relatively minor surgical procedure. We fitted her with an artificial leg, and for the first time in her life, Lakshmi is taking her first step in the parallel bar with confidence. You can see now back home, she's smiling, she's independent, she's regained the confidence that a little child like this should have, and she's walking to school by herself with the other children. She often also is able to participate in her recreational activities, and she's on track with her education at home and at school. So from there to here, this is what HRDC is able to accomplish, and this is an example of actually to the extent that we undergo to rehabilitate and treat our children. So this all started with my education. After my pre-medical studies, I had the opportunity to go for higher studies to India. Inter-regional collaboration and programs like the Colombo Plan make it possible for students like me to go to the best centers in neighboring countries. I completed my MBBS studies at the All India Institute of Medical Sciences in New Delhi, and had the opportunity and exposure to a unlimited, unparalleled educational experience. And following my studies there along with my classmates, I applied through the intern and resident matching program and was able to enter into a surgical and orthopedic residency training program in America, which actually opened the doors wide for me to pursue a career in surgery. And it would have been possible for me to stay back, but my parents having asked me to return, and I never have actually really worked in Nepal, I said I will give it a go, and so I returned to Nepal. And having never worked there, I was amazed to find no facilities to, really exercise my skills, and I started working in a very, very simple missionary hospital. Here you can see the old picture of this hospital, which is very, very sparsely furnished, but a lot of committed people. And the experiences that I went through in my initial phases of working in Nepal at this hospital and at several other hospitals like this completely transformed me. The choices for me were very stark. It was not the question of even making a living at this time. Was I going to undertake the challenges that were present here, or was I going to run away? So I realized that it was a great opportunity for me to be a change maker. There is a little story of Kajiman Chepang, a little 13-year-old boy who had to leave home because there was no food. He went and started working along the highway as in a little tea shop, and one night when he was helping some passengers passing by ferry their luggage from the bus down, something fell on his back, he became paralyzed and he couldn't move. So he was languishing on the road for several days before some good Samaritans dropped him at a city hospital. When I encountered this child at this hospital where I worked, it was already 3-4 weeks beyond his injury. He had pus pouring out from his legs and hips, and the only way I could save this child was doing a bilateral hip disarticulation. And this is a picture of him in that state. My colleagues did some diversion procedures for the urine and bowel, and finally, with all our expertise and help, all we could do was, give this boy a wheelchair to move around in a little basket. We never really were able to get his smile back. So these were the kinds of challenges, that I encountered day after day, and it propelled me to, think and say to myself, if opportunities arise, I must create better facilities, create better platforms for work, and help more people. So this is one of the examples of what happened. Another example of a child, he is 16 years old, he has never walked, he crawls on the floor, he has suffered from poliomyelitis, and his life is just a bundle of misery until our services came to him, and after a series of very simple operative procedures, for the first time in his life, he is standing, he's got his confidence back, he pursued his education to be a school teacher and started working in a little school and did something of his own, looking after children. And the story goes on, and recently, when we had a vacancy in our own hospital for a social worker and counselor, he applied and he was selected, and here he is now married with a family and at one of our annual gatherings of our old past patients, so a story so beautiful and complete, rehabilitation of Manbadur Rai. So the realities facing me, back in Nepal were quite straightforward. There were a lot of resource limitations, there was no working platforms, there were no existing systems in which you could work to exercise your skills, and the pathologies were presenting late, often problems that could have been prevented. The pathologies became complicated and the work volume was unlimited, and the variety also was similar. So taking care of problems that present late with complex pathologies increases costs unnecessarily. So it was very, very, very difficult for me to decide how to balance these conflicting realities. The global burden of surgical disease is kind of a fact that has been underestimated. There are nearly 401 million annual disabilities adjusted life years for surgically treatable conditions. It's almost there in epidemic form, and there is an epidemic of surgically treatable conditions in low and middle income countries which receives very little funding. So this is another example of my own experience, not being employed but keeping my surgical skills updated. I was volunteering from one hospital to another, and this is a experience of a little work that I did in a leprosy hospital for several years, and in very simple surroundings we were able to actually provide a lot of care for children. And I sometimes had to take my family, my wife and my little daughter with me to show what the patients in our country were suffering from, and the needs for them to receive better care, and what I was able to do. So this is where the Children's Hospital first began. We were first initially located in this premise where the hospital was a 32-bedded setup with very simple facilities, very sparsely equipped, but the work just took off and there has been no looking back. We had to move to a different facility, a rented place where we stayed for about 5 years, and then we planned and we looked for funding and wrote to our friends all over the world, and finally in 1997 we relocated to the facility where we are now present. This is a beautiful hilltop location about 20 kilometers outside of Kathmandu, with on a clear day commands a panoramic view of the mountains, and it's a beautiful location for children to heal and recover. So all along from day one I realized that this kind of work, which is going to increase in complexity and volume, cannot be done single-handedly. So teaching and training has been a part and parcel of our work. This is a small group of our team of doctors and nurses on a working day at HRDC. Recent photo. So this is a larger picture of the Department of Orthopedics, and we have expanded our team to include now more than 25 orthopedic surgeons with varied skills that are able to provide complicated care for children who come to us for care. This is another example of a child from far west Nepal, Tankeshwari, coming from a very, very poor family. Her parents are laborers. She has this congenital dislocation of her knees which never received any care. And as years grew, she's walking on her fours like a quadruped. And these children become ostracized, they are unable to mix with other children, and even in rural surroundings, the life for children like these are miserable. So, but everything changed once she was able to attend one of our clinics where she was referred to our hospital, and we undertook some surgical procedures, and again, for the first time in her life, she's standing and starting to walk. There she is. You can see a girl who's now confident, is able to give a smile, and these are the kinds of goals that we pursue, to make children happy and able. So, talking more about education and training, we have been involved with training at all levels, paramedical level. We run a physical rehabilitation course, and we have now accrued a huge information bank which we use to train people from other institutions for disability care. We also provide continuous refresher training for our own staff through collaboration with local universities. We have graduated 33 orthopedic surgeons. The training program is still ongoing in another capacity, and most of the surgeons that have graduated from my program are in Nepal, and all are performing exemplary work in leadership roles in different parts of Nepal. So The collaborations have come gradually. Some of our oldest collaborators are still with us. American Himalayan Foundation is one of them who has been helping us out from now more than quarter of a century. This is one of their annual functions in San Francisco where I was asked to give a talk. So our categories of diseases are quite similar actually they are prevalent in other low middle income countries. Congenital problems account for a huge volume of our work. Neuromuscular conditions, trauma related disabilities, trauma that is untreated, complicated, and then home accidents like burns account for a steady volume of work, and then other problems like tumors, infections of every kind with complications, and miscellaneous groups which are metabolic disorders and things like that. So the hospital has got a large pool of very, very varied pathology, and extremely challenging for us to decide how to plan treatment for many of these patients. And through our dedicated staff of workers at every level, we make a comprehensive plan of what is achievable for each child that comes to us, and then we proceed. So this is Chandan. He comes from again far west Nepal. He has this complex syndromic deformity of his legs. He's a sad boy if you look at his face, because as you grow old, become an adolescent, it is difficult to interact with others in the school because of your problems, and people look at you differently. And luckily, he again encountered our peripheral clinic staff who referred him to the hospital after a series of complex surgeries to straighten out the deformed limbs. There he is, standing on the brace, more confident, few inches taller, and there he is now, a juvenile adolescent, and happy and back to school pursuing education. So we start treatment, we see it through completion, and where children require follow-up care, we continue to do that too. Another example of the severity of deformity in a child who has never received any treatment. This child has got a congenital problem called osteogenesis imperfecta, along with a skin problem, and he was brought to our hospital by some other community workers, and after evaluation this child underwent a multiple series of treatments. He was in the hospital for several months, but there you see, he is now standing on his feet, on his own, and despite his having a problem that is not fully curable, you can see the confidence that has come into the child's face. And these children have a great advantage of being HRDC patients, because we follow them through and identify complications and provide whatever ongoing care is required after the initial treatment. So a lot of our work requires the collaboration of technicians who are able to manufacture artificial appliances and limbs. From day one of our hospital commencing services, we had a workshop on the premise. This is a bird's eye view of our workshop, where we actually are able to manufacture cost-effective appliances, orthotics, prosthetics, and the like for our children. Here is an example of a young girl who has lost both her limbs in a bad trauma, and after some simple surgeries to revise her amputation stumps, we have fitted her with prosthesis manufactured at our own hospital workshop. These prostheses cost about $25 each. You compare them with the carbon fiber blade prosthesis, so anything that is very expensive is not actually, it doesn't make any practical sense to the kind of work that we do. So even if there are solutions, if they are expensive, they really are not applicable to our situation, because we have limited resources and we have to deliver a lot with what we have. So our community-based rehabilitation work extends to all the nook and corners of Nepal. On an average, we conduct about 150 days of field work per year. We have 5 satellite clinics, and we have HRDC field staff who are committed to the CBR work, who are constantly organizing camps, sometimes for surgery, most of the times for follow-up, awareness drives, school screening, etc. So both the community-based service and the hospital-based services together make the work of our hospital comprehensive and complete. Getting to the field in Nepal, rural roads are challenging. Sometimes there are no roads at all. This is just an example of one of our vehicles, having to surmount the challenges of the terrain. Here in a far eastern district in Okhardunga, with our team, I am also reviewing a patient in one of the camps here. You can see that's our team of doctors. The doctor in this black shirt is my son, Dr. Vivek. So here is a view of the camp done at another extreme remote area in western Nepal. So we make no fuss about where we do the camp. As long as we have groups that collaborate with us, the patients may be examined in the open field like we are doing here, or it may be a school building, or it may be a health post, or it may be a local hospital. So we just get the work done with our partners wherever they are located. So the camp is always busy, like this picture shows. So people are waiting in line all day, sometimes making long hours of trip to come to see the doctor. We often give our appointment dates right through the follow-up clinics, and the terrain and the logistics are very, very challenging, but we never let that be an excuse for curtailing or cancelling our work. There are some of our doctors working. Now, talking about collaboration, South-South collaboration. Here is my son. He went to medical school in Jaipur, and we are very fortunate that, collaboration, inter-regional collaboration like this makes it possible for us to pursue higher education. And now that my son, who after his graduation spent some time in the UK and then in America and also did his additional training with me here, he's come back and joined the team, has taken a huge responsible role in running of our hospital here. So, excellent example of collaborative work. This is the medical school in Jaipur where he spent his undergraduate days. And we have identified through our work a number of barriers to care access, so patients should have access to care. There has to be spatial access, financial access, cultural access. The care has to be available, it has to be affordable, it has to be acceptable. When all these issues are addressed, then you can achieve your goal. Clubfoot is one of the most common congenital problems that we treat. We are one of the leaders in the world in this particular field of work. We see hundreds of patients. Maybe we have treated more than 10,000 patients with clubfoot over the years, and we have contributed to the world literature on our experience in this particular recurring congenital problem. So what we do with our patients, we identify, we treat, we establish a rehabilitation scheme, and then we try to socially reintegrate the children. The hospital has a school where children are kept abreast of their educational needs. 3 teachers actually make sure that every child admitted to the hospital is learning how to read, is continuing with whatever their school, wherever they left off at school. Some children have finished their high school examinations here. So we also have a very vibrant child protection policy that is in effect. So it's a very disability friendly hospital infrastructure with all these adjuncts. These are some of the major publications of the last couple of years. The work has been recognized through various awards is the World of Children Award, World of Children Alumni Award, the Star Impact Award. We have some statistics here: more than 90,000 children treated, more than 75,000 fabricated appliances, more than 44,000 operations performed, etc., etc. So to conclude, North-South collaboration has resulted in HRDC and its work because we have the opportunity to train and study and acquire skills that we have been able to put back into use in our own home environment. We are able to work with the UN Charter goals related to the rights of every child. The HRDC work has highlighted the need for more resource to tackle disability resulting from surgically treatable conditions.